Welcome to St. Augustine this evening. The Mike Davis Show. And boy, do I wish you could listen to the last 2 minutes of show prep every day.
If not 10 seconds.
Oh, goodness gracious. Amanda, you kiss your children with that mouth?
I mean, honestly. A woman's struggle, Mr. Davis. Get with it.
I cannot believe that language out of you before
Where
this
is
show.
Barbara Jean when we need her? She's our
Barbara
attorney.
Jean,
Yes.
I know. Barbara Jean missed it all.
Oh.
Oh, and I did find a story that only Barbara Jean could appreciate today.
Oh, she'll be so happy.
Oh, I don't know if we can do it. I have to go back and look at it and see if it's actually...
Save it for Thursday.
I don't know. I might need Davey's advice on this one.
Oh, for real? I have a purpose.
I might need Davey's advice on this one. Yeah. I mean, there's a whole bunch out there. We have a great guest with us today.
Yes,
We have an amazing show.
excited.
Davey is in the house.
Hello.
It's so good that you get to be yourself on one of the 17 shows that you do every day.
I'm just trying to make the magic happen.
You're just so
I want
under
to be the
wraps
pulse.
on all the other shows. So underappreciated. So talked down to. Davey, they're not going to talk. We're not going to talk to you that way on this show, Davey.
No, listen, I will get you from darkness to light. I'm a leader of the light. Let's go.
But when
Yes.
you're not here, we will talk about you.
I know this. This I know. I know. My people tell me.
Actually watch it.
I know. I love when he watches. Yes. All right. Opening their doors in 2008, Brightway Insurance, the Casey agency, has proudly stood by their customers through hurricanes, major floods, hail, and fires. Through these events, the agency has become a much-needed insurance resource in times of trouble and hardship. Honesty and integrity are the pillars of their core values, says owner Ashley Casey, and they pride themselves on being insurance experts while developing strategies that help their clients meet their insurance needs. And boy, we need insurance needs met in Florida. We truly enjoy the relationship that we've forged in the office and have a real love for St. Augustine. Ashley Casey, Brightway Insurance, give them a call. They're great folks. They insure this show. They've insured it from day one, which tells you the amount of risk that they are willing to take.
Brave crew. Another brave crew is the crew at A to Z Roofing and Waterproofing. They offer free estimates and they've been serving St. Johns County for over 20 years in the construction industry. They offer painted metal roofs for saltwater area homes with warranties for up to 25 years.
25 years. Do they have anything with cedar?
Maybe. Cedar shake shingles, designer roof coverings, flat roof coverings, all recent job photos with material descriptions can be seen at A to Z Roofing and Waterproofing.com.
Bro, no, I'm just kidding. Let's step into the world of support and healing with our great friends at Epic Behavioral Healthcare. For over 50 years, Epic has been the beacon of hope for our community, providing compassionate care for those touched by substance use or mental health disorders. Whether you're a kid, teen, adult, couple, or family, Epic is here to lend a helping hand. With a range of programs tailored to meet diverse needs, Epic offers accessible solutions for everyone. From walkout access centers to a mobile response team, their inpatient detoxification and outpatient counseling, Epic provides a comprehensive care every single step of the way. We love them over there. We're going to be talking to Teresa coming up real soon. I know Tips for Kids is coming up, you guys, which is going to be an amazing event that a lot of people rally around. A lot of good food, a lot of good people serving you. Have you ever done a Tips for Kids?
I have done Tips for Kids.
What was that like?
It was amazing, but I was held back the entire time because my partner in crime
Was Troy?
was Troy.
Oh, the worst! He is the worst at this. I was his partner 1 year too. Oh,
It's like literally you're waiting on twice as many tables.
he's like Johnny Bench, just hanging out.
No, he's like,
having-
I'm keeping them happy while
Yeah.
you're doing all the work.
Oh, the worst.
That's exactly what he says.
But he does make the great drinks. He is a good drink orderer.
We were in a meeting today, nonprofit, and somebody said, well, before I accept more responsibility on the board, I just want to know from you and Troy what it's like. I said, Troy, how many jobs do you have? He said, I have 8 jobs right now. And I said, he's got 8 jobs. He's still on this board, but he still works less than 20 hours a week. So you can do this. You can 100% do this. If Troy can do 8 jobs in this, you got this.
Anybody can do it. That is
Yes.
it. The beacon.
That's what I said. All right, the team at South State Bank is a group of bankers you can count on. Their approach to building long-term relationships with their customers is the best in the business. If you're looking for a banking relationship you can depend on, check out South State Bank. They've got 3 locations here in St. Augustine to serve you. One on State Road 16, one on State Road 312, and my very favorite one, the branch at the beach. Or you can visit their website at southstatebank.com. They are a member of the FDIC, and we love them. They're awesome folks. Great job. All right. We have a very important guest.
Yes, we do.
A very
I thought that was
rambling
Davey.
guest. Very, and you're back. You came back. So apparently it wasn't so painful and awful and terrible.
It was a lot of fun.
Yes. Stephanie, welcome back.
Thank you.
Well, Palencia Dental.
Palencia Dental.
And we're happy to have you back. So did you make it through the holidays okay?
I did make it through the holidays.
Okay.
Yes.
Yes.
Yeah.
We've all missed Davey tremendously. We came in here and cried every single Tuesday that
We
Davey
did.
didn't show
I
up.
want the rosary. I want it all. Light a candle, all the niceness.
Well, actually, in your defense, Tuesday night was Christmas Eve and New Year's Eve.
I know. That's why
So
I took advantage this year. I had to
we
get
weren't
out of
going to
town.
be working anyway, so I'm giving you crap over something that I wasn't even here for. So.
Perfect.
But yes, so you survived.
I survived.
Have you
I missed the
cleaned-
carousel tree.
Have you cleaned a lot of like candy out of teeth? I mean, like seriously,
Candy
this
cane.
is like the holiday cleanup, right?
You know what? People are a little motivated for that.
Yeah.
Yeah.
But I do hand candy out on your way out. So
I love it. It's the revolving door. So
right.
smart.
Can you please tell us that candy corn is the worst thing for you to eat?
Oh my
Can
word.
you please tell us that?
Yeah,
I
could
love
you?
candy corn.
It's 2-2 now. We were 2-1. Now we're 2-2. Oh, Dr. Stephanie, my heart just hurts. Oh.
You know what they say? You should never ask a question if you don't know the answer.
Yeah, true
You should never ask a
story.
question.
There goes your
I love it.
legal
Just keep
degree.
doing this. So he has gone in on candy corn with multiple guests because he hates that I like candy corn, and every guest that he's done this to has been a
Like-
candy corn fan.
Huh?
Yes.
That is so funny. That's
So you're not rating the bowl there that's sitting.
no,
You could put 8 million of them in here and they'd still be here at the end of the day.
no. Yeah, he even bought her like soap for Christmas that was
Yes.
candy corn themed, right?
Yes, candy
There
corn
we go.
scented soap.
So, you know, that's an option
smell.
for you, Dr. Stephanie.
I don't know if I need that.
Smells sweet.
It's a big brick of soap that
Yeah.
Duke Cannon sells, and they have all these different smells with it. Some of them are based on beer. There's a Buffalo Trace one, which I like.
I was going to say.
That's a good one. But the candy corn one came across, and I'm like, oh yeah, I'm buying one of those.
There's
Oh,
some
yeah.
martini they make that
Yeah.
is. Yeah.
Now,
Candy
all of a
corn
sudden, you know, I whip. You saw the
saw
blonde
that.
hair just whip right over. Yeah.
The highlights flip.
If she had been with Morgan & Morgan, she'd have signed you up for Whiplash.
I'm ready.
She'd have said you make the
Oh, you
dice.
can join the club. You know?
Speaking my
language.
Yes, good. So our first segment that we want to get into questions with you is, but doctor, it doesn't hurt, right? Is this what we're focusing on today? What is this all about? Like, what's the premise of this?
The premise is, and the last person I saw before I left today, well, you know, when it starts to bother me, I'll do something.
Right,
And
yeah.
and the whole if it ain't broke, don't fix it type mentality, which is great for some things, but unfortunately with teeth and oral health in general, it's usually too late. It's kind of like cancer.
Right.
You don't notice it until it's really gotten bad.
There's
And
nothing more
so-
painful than dental.
Yeah,
right?
and toothache.
Ugh.
People will tell you it's the worst pain ever. They say it's worse than childbirth. I don't know, but
I don't know, but yeah.
From my experience, I had to have a root canal 8 days after I gave birth.
Oh my gosh.
No. I mean, the giving birth was the bad part of that week.
Yeah.
Oh, it was. Okay, so you are really the aficionado for this answer. I love that we have somebody. Look at your panel. So strong.
We are very well rounded in this room. We know everything about everything.
This is amazing.
We do.
Lots of
Somebody will know
experience. That's what
something.
that is.
Yes.
The doctor had, I think she had 8 kids. And so I had a newborn and I was exclusively nursing. So she would like stop. She'd kind of time treatment. So I would go and nurse in her office. My mom just waited in the lobby with my newborn. And so my mouth is numb and I'm like, and then I'm nursing a baby. And
Your
then
new
giving
name
back
is G.I. Amanda. That I've never. You were like Linda Hamilton in Terminator 2 getting out of the pool with 2 shotguns.
only
Like,
slightly less.
wow.
During my root canal.
Wow.
I don't know. I don't want to go through all of that. I can tell you that right now.
Yeah.
You're tougher than me.
For real.
Yes.
Yeah.
So what was, I mean, people tell you they don't want to do anything about it. I'm assuming the majority of those are men. Because we tend to have like, hey,
Yeah, we
we're going to
think about
ignore
that.
this until it really gets bad, right?
Yes.
Yeah.
Don't sell us out. I'm kind of half.
Everyone knows, Davey. It's like the worst kept secret in
Right.
the world. Everyone knows. Yes. Wait a minute. Let me explain this to you. If there's a guy that's coming there and says, I think this kind of hurts, you're like, no, it really doesn't. You're fine. And they keep coming back again. They have a different problem.
Yeah.
Right? I mean, dudes are like, okay, yeah, I'm going to go to the dentist because I lost 4 teeth. But when I lose a 5th one, then it might be a problem and I'll go. But I'm going to hang in there for the first 4.
Right.
Yes,
Yeah.
That's
You're
the
right.
whole, I'll get there
So,
when I get there.
dude, I'm going to say, what is our one thing that we don't like to do, which is like, it's going to take forever, right? It's going to soak up the entire day. Is that one of your like qualms?
No, it's not one of mine at all.
Okay, it's one of mine. So,
Listen, going to the dentist now is easy. As a kid, I got put in a car, driven to Palatka, and went to the dentist there. I think I told the story. There were not great dentists in St. Augustine back then.
you went to, what did they do? Put
that's
like a
right.
rope around a tooth and shut a door? Like, how did they do this?
No, they used the same tools at the lumberyard. They were awesome.
Dr. Stephanie,
No, there
please
was
save
actually
us.
a decent. There
Please
was a
just
decent
save us.
dentist there, and that was where my mom went, because if you were a kid in St. Augustine in the 50s, literally there was a dentist that you went to, and you say the tooth hurts on the left side, and they pull a tooth on the right side. It was like nobody wanted to go to the
the other
dentist in
left.
that age group. It was just like, no, we don't want to go.
More collateral for tooth
It's,
fairy.
it's radiating pain. It's,
Yeah,
it's
yeah.
coming from the other side. If we
Oh
pull
my
this,
God.
so you didn't have great dental care that you have now.
Yeah.
So how do you get them in the door? How do you get them from like, stop being ridiculous and like, come see me?
Well, word of mouth is always your best friend for that.
Sure.
And you get a reputation for being kind and calm, and for people, because anxiety is a real thing. You know, there's people that really legitimately sweating, crying, can't even pick up the phone.
Right.
And we see a lot of those people and we help them. So, and our first visit is non-confrontational. I mean, it is face to face. You can have some wine, you can have some beer, you can have some cookies. You can, we talk, we take some photos, and you're not laying back in the chair saying before you met anybody.
Right.
And that way it just gives you time to build some trust and figure out what it is that you want. And then we can, discuss options. Everybody wants options. You
Yeah.
want to be told what to do. So,
Right.
but it's nice to make an informed decision.
Excuse me.
And that's so important. All of us do different things, but in your case, you get somebody that's had a bad dental experience. You're trying to erase that
Right.
and still do a good job.
Right.
But you're already behind the 8 ball. When somebody comes to me and they've had a horrible contracting experience, I'm trying to erase that.
Right.
Davey gets somebody that comes to a spin class that there's a horrible spin class and a terrible instructor, and Davey has to make all that right.
I'll make that right. I am confident. But that's how Dr. Stephanie is too. I'm confident that I can
Yes.
make that right.
That's it.
Which is great. Because there are some like, have you ever like opened up someone's mouth and you're like, ooh, whoever like did these cavities, like, girl, you need to go back to some education. Like, have you seen that? Like the silver fillings that are like crazy.
Oh yeah. No, there's some old dentistry. There's people that moved down from Pennsylvania and New York.
Yeah, I know. I was one of
have a
them.
mouth chock full.
Yeah.
Yeah.
Davey, there's some old dentistry and some old people too.
why
I'm one of them.
This is why I'm a
So,
lunatic. I can't help it. It's the fillings.
There was no new dentistry when I was around.
Obviously,
no
we took
dentistry.
freaking Malacca.
Yeah, no, we have great new dentistry, good technology, and some things that don't look like they came from the lumberyard. I'm sorry that the good, bad, and the ugly is visiting.
No,
We love that.
That's actually really cool.
That's really good. Yes.
It's like that's so annoying.
No, that's good.
But
So what's a good care plan? Like, what do you tell your patients on a regular basis? Like, how do they stay on the regimen? Isn't consistency a really important factor
right,
here?
prevention, ounce of prevention. That whole thing is really, you want to be proactive. And there are very telltale signs of things that could go bad. And,
Yeah.
and it's just, are you the kind of person that waits until the car breaks down on the side of the road, or when the engine light comes on, you maybe go take a look and see what's going on? So
I
you
go
can do
right
the-
away.
Yeah. So yeah.
Well,
So you
because
can-
I needed to run for me, right?
Right.
It's just like my mouth. I want it to work. I can't get slow. Like,
yeah,
it's
and
just
it,
not
and it
gonna
always
work.
happens on a Friday night or on a weekend or when you're traveling. It's never convenient to
Yeah.
have that dental emergency. And
So you're saying you come in on
we're-
Friday nights and Saturdays? You're like, you can pay me in. Yeah.
but I can prevent you from needing to come in on a Friday night. So,
True. Good.
that's kind of the plan, and consistency. So as an adult, we should all be coming in 3 times a year just to have a look.
So give us an example of somebody that you talked earlier about. I don't have any pain. I'm fine. Or I do have pain, but I'm dealing with it. And you looked at them and said, oh no, you were really close to losing.
Yeah,
So-
you have people who've worn their teeth down where you can see actually into the nerve or the pulp of the tooth.
Wow.
And-
Yeah,
and
they're
you're
like nubs, right?
and you're
Like real little, yeah.
exactly. And you go, no pain, no,
Yeah.
nope,
Nothing?
nothing's fine. Nope. People will break off a tooth and it hasn't hurt. So,
Oh.
and that's what I'm talking about. I mean, things that I could show you a picture of, and you'd be like, yeah, that's not healthy, or that's that's a problem.
Yeah.
And they don't bother people.
Hypothetical. Like
Sure.
you ask a patient, you're like, are you a smoker?
Yes.
And they say, yes. Are you secretly mad at them?
No.
Okay, good. That's a nice way. Okay, to clear that up. Okay, because I have the guilt. I do. I'm not a smoker. I'm not.
No judgment.
I'm judging you right now.
I know you
I'm so judging you right now. The healthiest person, you're out there all the time on the bike. How can you ride the bike? Are you lighting up in the middle of the thing where she's the
Hypothetical. Yes.
You know what that means in my world?
What does it
I'm
mean?
doing this, but I don't want you to think I'm doing that.
That's
Whenever you
right.
say that in my
That's
world,
allegedly.
yes,
Gosh, I gotta
yes.
teach you the street.
After
Yeah.
Stephanie,
No, but
I have a
honestly-
friend who's never brushed their teeth, but there's nothing wrong with that, right?
Right.
Yeah, right.
It's the judgment that we get a little worried about. How do you navigate through that?
So, I mean, we tell people even from the phone, they're like, "Oh, my teeth are so bad." You know, no judgment, and you made it in. Congratulations, you came in, you took the first
Right.
step, and now we can help you. You know?
Yeah.
And there's probably more options that you thought were available. So, you know, we just really try to encourage people and be supportive. And those that have quit smoking, we celebrate
Yeah, of course, absolutely.
because that's so
There's
hard
hope
to do.
for you, Davey.
No, it's good. Yeah.
You're gonna spin so much faster.
Oh yeah, absolutely. God's sakes, it's gonna be great. Instead of an hour and a half, we can go 5.
Yay!
Let's go.
I'm never signing up.
Yeah,
for
yeah.
that.
It was just like, count me out.
Yes. I'll get 12 other people. I can do this. We'll tag team it.
Exactly.
Oh, no, I can do. Long term, what's the value of people coming in on a regular basis, right? So if you have someone that comes in on a regular basis, do they have less problems overall than people that like come see you only when there's a problem, or maybe they come see you
Right.
once a year?
Yeah, no,
or
it's going to
something?
save you time. It's going to save you money. It's going to save you pain.
Yeah. And how often do you recommend they come see you?
So adults over 35 should have their teeth cleaned 3 times a year.
Well, let's talk about those 3 visits because one is an X-ray, right? And the other 2 are a cleaning, I'm assuming? Okay.
Correct.
Is
Yep.
one a more extensive cleaning or like how's that look?
It depends on what your gum health is. So
Okay.
people who have periodontal disease, have bone loss, that kind of thing, then they have a more extensive cleaning. But
Yeah.
it shouldn't be more painful or anything like that.
So I look at teeth cleaning like massage therapy. Like every therapist is going to be a little different. Like one is a little bit more deep tissue, one is a little like
Sure.
How do you navigate through those waters with
Yeah,
people?
so
Okay.
you have people that are
Get it
very
for me, yeah.
sensitive,
Okay.
and some people are like, I want to feel like somebody got in there and cleaned my teeth.
Right, I'm not
yes,
afraid to cry. Like I want it done. Yeah, like perfect. Yes.
We don't have to make you cry. To make
Okay.
it perfect. I'm just saying.
You're like, where did you
Let me
go?
throw
Did
that
you
out.
go to Palaca? I'm just kidding. I'm just
Palaca,
kidding. Yeah.
apparently.
You're going to the dentist. There's other places you go to for Davey. I'm just going to leave it alone.
We're
gonna
gonna make
leave
a
it alone.
slideshow of all of Mike's faces from this episode.
I know, this is great. I know, I love doing it too because I can see it in the corner of my eye.
Oh no!
The
no,
nostrils flare. Yeah.
But most people have had their teeth cleaned at some point, so they might bring that up. You know,
Yeah.
hey, this is super sensitive. And if you have infection or bleeding and those kinds of things, that makes it more sensitive. So it means that you might come a little more often.
What are
to
some of
make
those
that go away.
like factors you can tell that you have an infection? Like, what if I'm flossing and all of a sudden I start bleeding? Does that obviously there's some underlying thing that's going on
Typically,
there, right?
you could
Yeah.
be flossing incorrectly or too hard.
Ooh, gotcha.
So there's that.
Okay, yeah.
People who like to floss 2 days before they go to the dentist to say that they've been flossing.
Right.
That usually causes
a
bleeding.
couple family members like to call them out. That's awesome.
Yeah.
But last time you were on, you talked about the water pick and how beautiful that is.
The water
for
pick
people,
is a
right?
beautiful thing.
It's a little
Yes.
bit less invasive than a lot of.
I think it's easier. People
yeah.
don't like to get their hands in there. They don't like the taste of their fingers. They don't like stuff coming out between their teeth. You know, the water pick seems cleaner to them. I
love
think.
it.
Yeah.
How
It's
is
so
the
fun.
water pick for braces?
Good
for
right.
keeping
It's
braces.
fantastic.
Okay.
Yeah, it's really good. And then you can get some of the electric toothbrushes have an actual special head that gets underneath those wires and stuff.
Okay.
I mean, cleaning braces is tedious. That's just what it is.
I have
to
a-
do it
I
correctly.
have a kid with a little mouth and a new set of braces, and I'm trying to figure out
Oh my
how
God,
we
no
can clean
Cheetos.
those teeth. No
You
Cheetos.
can't.
And then there's that.
So the lady told her she's not allowed to have any toes. Nothing that ends in toes.
like
Cheetos.
Cheetos. Okay,
Yeah.
Cheetos.
Yes.
Yeah, we're not going
So
to very
Oreos are
right?
okay.
Okay.
Yeah.
She wasn't a cannibal, Davey. She's not a cannibal. She's just giving advice, Davey.
So I was like, wow, where are the toes? That's really where I went.
No pig's feet either, Davey. No pig's feet. They're out.
Pig's feet are great.
Not if you got braces.
True. Oh my goodness.
Problems. Those hooves, they get stuck behind braces.
Yeah. What are braces like these days? Because back in the day, like they had like the little rubber bands. Is that still like all a part of the whole So they haven't really evolved. It's still kind of the same.
Well, they have the they're called self-ligating brackets if you want the technical term.
Yeah, I do, yeah.
But it has like a little door that slides locked, so they don't have those around there.
Okay.
That moves the teeth a little quicker because the wire's in constant motion. And then they have clear ones, so they're not as obtuse. So sometimes people will put the clear ones on the top and the metal ones on the bottom because you can't see the bottom as much. And then, of course, we have
it's painful though.
all the Invisalign clear aligners. There's, like 20 companies now.
Does it
that
hurt?
that.
Does it like I heard
Yes.
it's not an easy
Yes,
thing.
it hurts.
It does hurt. Okay, very nice.
This is the pain part that you've been looking for.
So yes, this might be right in my
Just
alley,
saying.
right?
Yeah.
Yeah. Because honestly, Dr. Something, I have a crooked tooth down here, and I can't get a date in this town, so that's probably what the deal is.
I
So
can help
maybe
you.
okay, perfect. Yes,
Not a
perfect.
problem.
Yeah, my daughter has the brackets that have the doors, the Damien system, I think they're called.
Yep.
And so they were telling us like the wire goes in and it has like a memory. And so the wire goes in and her teeth are the wire's all, looks like Charlie Brown's mouth after he misses the football.
Oh yeah,
And
yeah.
It's less than a month.
Yeah.
And her teeth are just, I mean, it was a painful first week.
Yeah.
And this girl does not like pain medication. And she was like, yes, give me the Motrin and the Tylenol. Like,
Okay.
she is not the one to take pain medication at all. She hates
Interesting.
it. She
Yeah.
doesn't like the taste. She thinks it's going to make her sick. So she doesn't like it.
Right.
But she was taking it on that schedule. Like, is it time yet? It hurt. But
Ooh.
there's already been a ton of movement in her
That's
mouth.
great though.
It's wild.
Is she feeling more confident? You noticing any difference?
Oh, yeah. Like, I mean, the braces are a confidence hit a little bit.
What was the
'cause, like,
conversation like before, like the braces? You were like, we got to do this, boo. Like, what were you?
Well, so her siblings have both had orthodontic care. One had braces, one had a retainer. So it's not
new.
brand new for her.
Right.
So it wasn't that big of a deal. The orthodontist kept saying, like, your friends probably have braces. Well, a lot of her friends have just gotten out of braces and haven't gone in. So she's kind of in the middle. So that didn't really help.
Yeah.
But, you talk about, oh, now you've got a glittery smile, that kind of thing. And that always makes her smile. And they still put the rubber bands
I was
on.
going to say they can
And
still
so
dress them up.
They get
Okay.
to pick their colors. And that's like the big exciting thing. And
So you can pick colors.
Oh,
yes.
Okay.
Davey's in.
Oh,
Davey's going to
yeah.
be there tomorrow morning.
But like, how often can you switch out your
Once a month.
colors? One. That's it.
Oh, yeah.
I mean, I
I
was
don't
just,
know.
yeah. Okay.
now he's,
Maybe
now
a
he's,
little
now he's
extra.
out. He was in, and now he's out.
I'm back to Invisalign.
You
Okay.
can't do the same color for a month.
Well, no, I mean,
It's not
and
right.
black would kind of look like a cavity, right? That was probably not a
Yeah.
good color to go with. Like,
I wouldn't
what's
go
like a
with black.
popular color?
Well,
Black.
sometimes yeah, blue and orange.
Blue and
Yeah.
orange. Okay. Okay. Yes. Very Florida.
Sparkle.
Yeah. Oh, there's a sparkle one?
Mhm.
He's
My-
in again.
My son would do Roy G. Biv.
Yeah.
Oh, smart. That's really good, actually.
Yeah.
That's actually super fun. Cool.
Libby's in a darker blue and a lighter blue.
Mm.
So
braces. What
Yes.
does that look like? I mean, obviously, that's been what? Is it a 6-month ordeal? It depends on the mouth, I'm
depends
sure,
on the
right?
mouth, yeah.
What's the longest you've ever seen that somebody go with braces?
Oh, 3
Yeah.
to 5 years.
Oh, wow.
Yeah.
So that's a thing.
That's-
Okay.
yeah.
Yeah.
It's not a very frequent thing.
Yeah.
So, I mean, the big thing with orthodontics in general is you want to start young. You want to start in the growth phase of the child. So you're talking 8 years old.
Yeah.
They even at 6, it depends on how quickly their teeth come in. You can do things to help that expansion because
Okay.
you really do not want to be taking out teeth for braces.
Yeah. That's
And-
another thing. Yeah.
And we shouldn't have to at this point. It's very, very rare to truly have that type of.
What does
you know,
adult braces look like nowadays? Like, are people, I mean, I have one of my greatest friends of all time. She still is rocking them. Like, she's
Yep.
just, this is my dream. I wanted to have straight teeth, and that's what I'm going for. Like, what does that look like in your industry?
So it's same thing. I mean, you're either doing silver brackets or you're doing clear brackets, and
Right.
and so many people. I was the 4th child, and nobody could afford for me to have braces.
Right,
And I've
yeah,
always
yeah.
wanted to smile, or I had all my kids got braces, and now I want to do something for me. Or I'm getting divorced and I'm on the market, and now I'd like my smile to look great. So,
Loving
you know.
that. Yes. I love that journey.
Can
Yeah.
I just take care of this for you? Do you have an opening tomorrow morning? Around 11. He's got a few things he wants to have done, but 11 he's free.
I always have things I want to get done. You always want to get to. How about you as a dad? Did you guys go through the gamut of braces?
Oh, yeah. I think all of them had braces.
Oh, for real?
I think every one of them had braces. Yes.
Must be genetic. All right, that's
Yeah,
cool.
it goes back to the father right here. I hear it's the father's fault.
My son is the only one that hasn't had to have braces. He just had a retainer situation. And my husband's like, he's the only one that likes steak and eats steak all the time. So I wonder if it's all that chewing of the protein that helps his jaw.
Such a dude thing to say, yeah.
Okay, Tim Allen.
I think my parents just
Wait a minute. Is Louis right?
No.
I tried, Louis. I tried.
It was
You're
worth a
just
shot.
saying that because of the candy corn thing.
You guys are in secret clubs
you're
or
in
something.
cahoots.
Yeah.
We're coding.
So what about the art of storytelling in dentistry? I know that's important because you're kind of gaining people's trust, right?
Sure.
Talk about like how you really kind of gain that trust and the art of storytelling, because I think it's super important.
Well, I think that people just need to relate, and if you're afraid of something, you want to feel comfortable. So storytelling is it's how everybody communicates, really. And if you can give examples, and we do that a lot with photos too. It helps people to really understand what you're talking about, and knowing that somebody else has done that they're not alone. Those kinds of things is always
Somebody that's been through it. You get that
correct,
empathy. Yeah, it's perfect.
Do you talk to them as you're working through the procedure so they know what's going on?
Yeah, that's a good question.
It's kind of interesting because you go to the barber and you're talking to the barber the entire time.
Right.
When you go to the dentist, it's like, hey, and then that's it until it's like time to switch. Right?
Not me massage, we be quiet.
But you need to do the talking. You can't be asking questions while your hands are like.
They can speak a language. They know wah, 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 wah means I need to use the restroom. Yeah.
For sure. It's interesting because some people in actually a high fear situation, just to be able tell them exactly what's happening and that they're doing okay, helps them immensely. And some people are like, do not talk to me. I'm gonna have the earbuds in.
I'm gonna disassociate here.
I would like to not hear anything and pretend I'm not here. And and that's fine too. And then we do sedation, come in and take a nap. It's fine.
You can do that too.
Yes.
Can we sedate Davey?
I don't know if that's going to take a lot. I would think you have
his
enough.
charm. Come on.
That's going to be a lot. You need enough for a giant horse. That's going to be a lot. I'm a large person. Not easy.
A large person.
Cosmetic confidence. So how do you help patients overcome hesitation or fear? So like when you, like you just said, the earbuds, they have a lot of different options, right?
Yes.
To be able to like get through it. And it's all about like their schedule. Like what if they're in the middle of a procedure and they want to start talking? Is it okay to like switch the focus on something like that?
Yeah, well, I mean, it depends on where you are, but and you want some things you have to keep dry. So there is that moment where you got to give me 30 seconds.
Got it. Okay, got it. Yeah.
But other than that, we were moving at people's pace. So,
yeah, that's nice.
And that's talking to them beforehand, knowing who they are before you're having them lean back and open.
Make them feel like a person, not just another cavity.
Right.
I feel you.
As far as treatment confidence, is there any way of doing like preview pictures of what you'll look like after treatment?
Absolutely.
Like that?
Yeah, we actually do that with where we'll take your smile and show you what it would look like with different teeth in it.
Very
and
cool.
it's interesting. So if you ever seen one of the shots with the celebrities and it looks like none of them have any teeth.
Yes.
Like Britney Spears, who's young,
Yeah.
and vibrant, and then you take her teeth out and she looks like she's, a 50-year-old hag.
Right, right. Yeah.
So
you do that as if
I've seen that in real life.
It's called the dog throat demon.
I didn't mean to say that.
No, but I mean, it's astounding how much it changes the face, and all it was a Photoshop, right? So, so we're able to do that, and then we have a lot of before and after, so we can show somebody, hey, this is somebody who had teeth like you, and they chose to do this, and this is what that turned out, and that definitely inspires some confidence.
Oh,
you can
that's
see
cool.
some results.
Okay.
Yeah.
Okay.
And our cosmetic stuff, they have a trial smile, so they're walking around with a likeness of what the final product's going to be, so that we can make some changes. You want to tweak something, you want something longer, shorter, rounder, square, different color, then that way before the final is in, you know that. And
Maybe you should just sell them as like a headshot. They can use them for like their profile
their dating
picture.
profile.
Right? Yeah, that could be like an a la carte thing. If you'd like this perfect image of your mouth, like take it's an extra $450. Like they'll use that.
Take the photo onto a dating site and see how many people swipe with different teeth.
Yeah. So get Nick to make sure he watermarks Palencia Dental on all these pictures so nobody steals them.
There we go. Tinder dentist.
Dear goodness me. So Kathy, one of our listeners, wants to know about kids sucking their thumb.
Yes.
More likely or less likely to have braces?
More.
Okay.
Wait, let's talk about this underbite. Okay, so I have the extended cap, Sammy Davis Jr. right over here. So my dentist back in the day, and this is from Delaware, so please forgive us. He told my mom that she should have had me continue to suck my thumb because that could have actually pulled the upper teeth forward more. Oh, what do you think? You think he was a
so you can move teeth? You know, it's just like. It's just like
he also gave me a small retainer. I should have.
You needed a big retainer.
Yeah, thank you, girl. Thank you. I needed big. See, Mom?
You know the pictures they show of the sea turtles that got stuck in one of the old six-pack rings and how it deforms the shell.
Right.
So you can do the same thing to your bone, and that's what happens with a thumb or finger. And if you're not breathing through your nose, so that's really the key. So if your kids are snoring, you need to get them in to have them seen because they should not be snoring. Got to be breathing through your nose. That makes the palate grow. That expands the palate. So
I just actually heard about this. There's a name for that kind of face where you have like the really the chin that's really in. It's like an retrognathic.
Okay.
Yeah. So like the nose it looks larger and the chin looks smaller and the jawline looks smaller and it's a sinus issue. And people are getting nose jobs for this when it's not the nose job. It's that they're breathing improperly because their airways are blocked for whatever reason. And so if they train themselves to sleep with their mouth closed, breathe through their nose, and now they have like tape that you can put over your lips.
Yep.
And so you can tape your lip closed. Don't get any ideas.
Stop it right
so
now.
That you can
only when you're
force
sleeping.
yourself to breathe through your nose while you're sleeping, and it helps your jawline and it helps your facial structures.
Correct.
Look at Davey.
This is awesome.
I'll see if I can find it.
This is awesome.
I was going to get you some of that tape for Troy in the morning show so you can actually have a few minutes to talk, Davey.
Oh, no, Troy has a lot to say.
Silence.
Well, you're doing the
What
work,
do you think
right?
about the mouth tape?
Yeah.
So actually, mouth taping is good, and it's not new. It's the same stuff that you use like when you have blood drawn, and it's whatever. But you don't put it like the duct tape in a kidnapping scene. You put it up and down, and you don't put it on unless you can sit and breathe through your nose for 3 minutes. So try it out on your child until they can sit with their lips closed and breathe for 3 minutes. So then it's fine. Plus, if you needed air, you would open it up while you're sleeping. It would you would overcome.
I like that.
But for adults, it's great because it increases the nitric oxide, not nitrous, but nitric, and that is very good for sleep and REM and brain and body. So
there's a lot of people that probably could
we
use
look
that
at
advice.
that because the sleep apnea and that goes hand in hand with the TMJ, and so we really look at that. People come in for stuff, and I'm like, you have an airway problem.
So they sell it at Walmart. Is this is this what you're talking about? Like Noctivo mouth
Can you
tape?
check Target? Like, why there?
I was just looking for
No,
it.
don't be that way, Davey. Davey, don't be that way. Don't be an elitist,
Target
Davey.
is such
Don't
a
be
better
an elitist.
experience for humans.
It's not purple.
Don't
The
be
one
an
at
elitist,
Target
Davey.
is purple. Here, I've got one at Target too.
It's probably having an exclusive color, and then you'll feel real fancy pants, right? Maybe it's sparkly.
it's
You don't
just
even
white.
know.
Let me see. I'm pulling it up. Here we go.
So let me ask
There
you,
it is at Target.
If the Target one was red and the Walmart one was purple, where would you go?
Target.
Okay.
I mean, I love the color purple. I'd still go to Target.
All right, just asking. Barbara Jeannie just
I'm
sold you
going
out.
lavender at Walmart. Thank you.
I can't. I get weak. So how's it looking for, if somebody needs dental surgery.
Yes.
Talk about what that looks like. I mean, that's obviously some might be, an overnight or a procedure, but sometimes it takes multiple procedures, right? What does that look like? What is dental surgery? What's the world look like in that?
What kind of dental surgery are you talking about?
I know, tell me.
I'm
Educate me a
really
little
nervous
bit.
So from
about what's
extremes.
wrong with you. I really am. As this show goes on, it gets deeper.
Well,
and
we want to know.
darker.
Well, isn't that your mouth? That's like the vortex of your life right there. It's where your life begins.
That's for sure. Okay, so most dental surgery can be done under local anesthetic.
Okay.
You can do sedation for comfort, that kind of thing. Even IV sedation. So think of wisdom teeth with oral surgeons. It's done in
Like, what if I have 5 cavities and I need a root canal? Like, how would you tackle that?
in
one
the
sitting?
morning. Oh yeah.
Oh my gosh, you're amazing.
Yeah. Why would I have you?
Because
come
I've
back?
heard that like sometimes they do the cavities one day,
Yeah.
then you got to come back, and then you got to do the root. So this is what I'm getting to. See how important that is one sitting.
I agree. I want you out of that office. I want you in and out of that office. I'm not having you back a second day.
Free to go.
Not many people like to drag things out to all
Right.
but yes, that's kind of the old standard. So but that's we do comprehensive, and so time is one of our specialties, and that's the less time you need to spend in the chair, better for you.
Yeah, I like that.
So
I like
I
that
could
a
see
lot.
you going in and asking to do each one at a time. Can I come Monday?
Depends
through
on the
Friday?
spa experience.
Uh-huh.
Because if it's a massage chair, Dr. Stephanie, I'll be there a couple times.
Uh,
Yeah, and especially you just said beer and wine. I'll probably be there another time. No, but that's also good. I think that's fun. I think you make it like a great experience for just about everybody. It's good. How's Wildflower Clinic? How's it handling?
it's exciting.
Yeah?
We're getting busier and busier, so that's good. They just went and spoke with the Florida Homeless Coalition. They're part of that.
Right. Yeah.
So trying to reassure, make sure that we still get funding for staff and for volunteer hygienists and that kind of thing, because it's sovereign immunity, so clinicians that practice can come and practice there.
Right.
Which allows.
Is it backed up for people to be able to sign up for something like that? Is it hard to like do scheduling?
It's for like volunteers or for people
I
coming
mean,
in?
actually, pretty much both of them.
Yeah. So we kind of go in waves. We're getting people in. We've got room, so that's good. But we can always use more volunteers for both sides.
Right on.
And anybody that's got any kind of medical background that wants to give some time, we welcome them.
Cool.
And anybody, administrative, there's always room up front, that kind of thing too. Marketing, going outreach.
So if there was
Everybody
a
can help.
dentist watching this right now and then wanted to volunteer time, and they're on the fence, what would you get them to say? Yeah, I need to sign up with Wildflower. I want to volunteer.
You know what? I would tell them to come down and see the clinic. Come and see what we do,
That's awesome. It's
and
remarkable,
talk to the people. It's remarkable. I think people think maybe it's some antiquated shed or something
Right,
like that,
yeah.
and it's not. It's a beautiful clinic with wonderful people, and the patients are wonderful, and you make such a great impact on the community and to people's lives. I mean, I when I did my charity party. One of the lady that was helping with the catering, her husband had fallen on hard times and had services there and was able to fix his teeth and made a world of difference in him being able to move forward.
Makes a world of difference.
It
really
does.
does.
Yeah.
When you just have the confidence that your mouth is.
People going around like this, that's not good for anybody. You don't
Right.
feel good. You don't, and you don't present that either.
Yeah.
So.
But I think we're all blessed with gifts and talents, and we work in a capitalist society, so you make money off of those. But whenever you can take that gift and talent and you can share that with somebody
Right.
for free who doesn't have the ability to pay for that, that is just that's a special thing.
Yeah.
That it really is fun to be able to do that. And
For sure.
It's like, okay, I have this skill and I'm able to use it to help somebody, and they didn't have to write a check. They just were able to come in, get taken care of, and Davey, free spin classes.
I'll do it.
See?
I would do it. Honestly, I would. Yeah, absolutely. Question for you though, like I'm sure you deal with price a lot. I'm sure you deal with like apprehension of sounds expensive. How do you tackle that? I know you said you give multiple different options, but are there also like payment plans and things like that?
Yeah. So dentistry is expensive. I mean, just like everything else, it's gone up. But we do. We work with a lot of financing companies, and they can finance some small and very large things. Sometimes when people are redoing a mouth because of different whatever it was.
My best
trauma.
friend, $35,000, redo his mouth. I mean,
Right.
made payments and happy as can be. I
Right.
know.
Yeah. And so yeah,
They look giant. They don't look great. I'm just gonna say it. You didn't do it.
I'm
That's
like,
why.
tell them to come to me.
I like giant chiclets. I want to make sure they look nice, right?
Right. Oh yeah, absolutely. Yeah. I do have people come in. I don't want my teeth to look like chiclets. I can't do that because they look fake. And I'm
Right.
like,
Sometimes they go to a foreign country because they're going to get, less expensive. Right. I
the
see you
horror
loud and
story.
clear.
The
Think
horror
of
stories.
is Ross Geller when he was tanning and then he whitened his
Do you
teeth.
remember?
So sad.
I totally remember that. Yes.
Why are your teeth glowing in the dark?
Right. But can you discuss on like people that fly to foreign countries to try to get that is a hot topic right now.
It is a hot topic, and there are great dentists in other countries. So I don't want to take away from that. But when you go and have something done with that magnitude, and you're not there for follow up, and you're not there, or maybe not speaking the language. I mean, there was a woman out of Australia that went to Turkey, and they have these Turkish dental spas. And she thought she was getting veneers, and she got her teeth taken out. I mean, you can't you can't undo that.
That's a fear. That's a fear.
Right?
Yeah.
Yeah. So so there
from
is some of
Australia to
that.
Turkey. I'm doing the math on the flight cost.
Right.
Okay.
I'm like, and
There's
nothing
a
against
Spirit
Turkish
Airlines that go.
dentists, but there's not a lot of them that you go, oh my gosh, that dentist has got to be from Turkey because he's so good. I mean, you just don't hear that, right?
Right.
But, you know, they went to the University of Florida. They must be good.
Yeah, right.
But you don't hear that in, you know,
Right,
the
you have a
University of
point.
Istanbul.
Yeah.
You know, it's just
Yeah.
such a great dental hotspot.
Yeah.
Yeah.
There goes Turkey in the algorithm.
And it's a beautiful country. Everybody should visit.
True. Absolutely.
But you know, it's like you might want to take that into consideration. So, and I've seen some things, and I've seen some great dentistry from other countries, and I've seen some not so great dentistry from other countries, and so I just would.
I just can't imagine going to another country not speaking the language fluently, right, and then relying on everything to go right. To me, that's just a leap of faith I couldn't get to.
Mhm.
There's no way.
Yeah.
So what's worse, Yankee dentists or foreign dentists?
Oh, here we go. Here we go. True story, because she did say,
Just the ones
Not
in
a bad
Delaware.
question.
Just the ones in Delaware.
No, this one was from North New Jersey. I'm just saying.
God.
Oh, I'll never forget the
We
moment.
have a lot of great dentists in the north.
Davey, he wasn't a dentist. He was a hitman for the mob.
Hey, I know a guy. Yeah.
Is it safe?
Oh my goodness.
Great.
Oh no. Wildflower. How often are you there at the Wildflower Clinic practicing?
So practicing, not but yeah,
just volunteering.
Yeah, no, well, the same thing.
Yes.
It is. I'm more administrative now, trying to do that. I get in, sometimes can cover if somebody can't make it, trying to give room for volunteers and expansion. So I am at least down there once a month. So
So I believe, is Wildflower expanding to another facility? I don't know if you can talk about this yet or not. Is that true or false in the works, or is it always going to be
in the works?
Okay, that's
Yeah.
awesome. That's
Yeah.
a really inspiring thing because it's going to open up so many services for so many other people.
Right.
I
Yeah.
think
No.
you're
What it
involved
is,
with
it's
that
gonna.
project
It's gonna.
too.
In
Yeah.
the works.
And I
In
know
the
it's
works.
I mean, you have a sign on the property, so yeah. I'm just saying, yeah. I was making sure that the rain mitigation looked good for you. The other
Rain
day.
mitigation looks amazing.
But that's exciting and that's super cool. How does Wildflower Clinic able to get supplies and things like dental supplies? Is that something that Palencia Dental has to supply sometimes? Or
Sometimes, yeah.
Okay,
And I have done that. It's so we have donations through some of the major dental supply companies, and then we have dental offices that donate, which is fantastic. And then we have some grant funding to fill in the gaps.
That's nice.
So,
Okay, cool.
No. And
Very
anybody who wants to donate, they can always reach out. Time,
100%.
time, money,
Yeah.
supplies.
What's more
Give me a
valuable
call.
to you guys right now, time or supplies?
It depends.
Okay.
So, we could use some more people on the medical side of things for sure.
Yeah.
We're always looking, if every dentist in St. Augustine community gave one day,
Mm-hmm.
I mean, we would never run out of people,
Right.
So
All it is just one day, which
Yeah.
is what is it, like a 6-hour shift or something? Or
4.
4, it's even better.
Mhm.
Okay,
Yeah.
cool.
And now some people actually, we are doing where patient will go to their practice and they'll supply the services there.
Mhm.
That way, they have all their stuff and all their people that know the way they like to do things.
Yeah.
And especially with some of the specialists, we've got some specialists that are really giving of their
What
time
about
and
dentures?
talents.
Do they have to
So,
go off-site for something like that?
No, we have somebody
Really?
on site, fantastic, that program's been going for several years. We used to send them up to Jacksonville, and now we're able to do them local. We got a local lab that makes the teeth, and
Are
it's
dentures
been
the last
fantastic.
resort pretty much for dental care? Okay.
Mhm.
So what is that like? You're pulling all teeth and then they're basically,
Well, you can get a partial denture. So
Oh, you can get partial,
Yeah,
okay.
you can have some that hooks onto the few that you have left, or
Uh-huh.
you can have ones that replace them, and they're not fun.
No.
Ask Troy to show
No.
you in the morning.
really?
You don't know?
How?
You
No
don't
idea.
know,
I'm
Troy?
not this good. Yeah.
Oh my
no.
gosh, he's got summer teeth.
He has some.
Summer teeth and some aren't. He's summer teeth.
What about halitosis? Is that a sign for an underlying
Lying
something?
infection.
Yeah.
Halitosis is a sign that something's going on. Sometimes it's systemic. Diabetes presents as halitosis too.
Yeah.
And metabolic disorders also present that way.
Yeah.
But infection in the mouth. When you were asking, how can you tell if you're bleeding when you're flossing? Well, if you have a bad taste in your mouth, if you have bad breath,
Yeah,
those are good signs.
definitely.
Time to go to the dentist.
Do you remember?
Or too
do you
late.
remember the commercials? The heartbreak of halitosis.
No, tell me.
It was a mouthwash
Was that the
commercial
Scope?
in like the 90s. Yeah, it might have been Scope.
But
it was
that
the
was the morning
heartbreak
breath
of
one.
halitosis,
The
and
heartbreak.
they're like trying to not talk to people, and it's like try this. And yeah, nobody else, just me. Okay.
Just you. Just you.
I don't
remembered
know,
that.
but now you're gonna send me to YouTube, and I'm
Did you get it
busting
cured?
out.
Just let us know. Did you get it
That's how I
cured?
knew that bad breath was called halitosis. Was
Right,
because
from
of
the
that
commercial, yeah.
Oh my gosh, I love it.
So, heart disease,
Yes. Bad.
dental health. Yes, but
Are they connected?
But dental
Do not
health has an
recommend.
impact.
Dental
Yeah.
plaque, dental and cardio plaque, same stuff. Same stuff. Yeah. So heart disease. And that's one of the things of why we talk about prevention and going to the dentist more frequently. Because if you end up in a medical emergency situation, sometimes you aren't able to go to the dentist or they prohibit you from going for a while. So before you have that surgery, you should be in there getting everything clean and healthy.
Yeah.
So that it helps with we have diabetics that are able to decrease their medication significantly once the infection is taken out of their mouth.
Wow.
It just has a profound effect on the whole body health. And heart disease is one that's been closely linked, and now Alzheimer's. So nobody wants Alzheimer's.
No.
And yeah, they're finding that some of the same bugs from periodontal disease is linked with that. So
So do you have a success story that you can tell us tonight before you bust out of here? Like what do you have a memorable moment where you've impacted someone's life completely with dental care and completely changed their paradigm?
yeah, so I mean, you have people who cry because they weren't able to smile and show their teeth before, and now feel like they can go out and do something. One of my favorites is a guy who he actually had tetracycline staining. So because he had drugs, antibiotics as an infant and prenatal, his teeth were a very dark gray, very fun-loving guy.
I worked with a girl like this. I know exactly.
And he's like, you talk to somebody and you go to smile and you just see this recoil in people's face.
Yeah, we thought less calcium, but that's not the answer. No, okay.
No.
I was not good. Yeah.
And to make that change, he said was unbelievable. Now talking to people and how they interacted with him. But I've also worked with people who are victims of domestic violence, and to be able to restore them and make them whole, and just give them that confidence, go get a job, that kind of thing is just makes you
amazing and
happy that
remarkable
you do what you do.
One time I got in a fight in college and somebody took a porcelain statue to my face and like cracked my front tooth. Fixed it right up, MBD, like it was like no problem.
That's
and then I was
wild.
back to being on America's Next Top Wannabe Model.
Of course.
Didn't work out, but yeah, it's too tall.
I wasn't a judge. I would have passed you right through, Davey.
I wasn't. Too tall.
Stamp approved.
6'4", way too
Yes.
tall. Dang it.
I would have. So foods.
Yes.
Like a top 5 food and a top 5 worst foods you can have for your teeth. I mean, there's really good foods and there's really bad foods. So what are your top 10 or top 5 ones?
Top 5. Okay. Well, so the bad ones are easy, and most of them are drinks. So sugary drinks. So Mountain Dew.
Yeah.
Monster energy
Oh
drinks.
yeah. The energies. Yeah.
Gatorade.
Really hidden
High
sugars.
A lot of sugar in
sugars,
Gatorade.
yeah, those kind of things. But then sticky foods. So
Taffy.
taffy's bad.
Oh my God,
You wanna
raisins,
find
raisins, all that stuff.
So you got to brush your teeth. That's what cheese.
Right
So
afterwards.
cheese is good because cheese then decreases the pH, levels it out. So,
Gotcha.
so you're not having as much of that. The apple a day still works for you.
Of course, yeah.
But foods that crunch are good foods, like celery, that kind of a thing. Nuts can be a little too hard sometimes. You got to be careful with that.
Right.
Is
But
celery really a food?
It is. It gives
Is
it
it really
peppery.
food? I
It's
just wanna
wonderful.
know.
Fortified water with cell walls.
It's
That's all it
delicious
is.
with a peppery feedback.
I
Yeah.
hate it.
The peppery feedback.
I love a celery moment. It's good
I know.
crunch.
I knew that was you in
Mimosa,
the food
peppery
review
feedback.
that I read.
But I mean, a lot of people are juicing nowadays. A lot of people are trying to be healthy, and that is also, you have to be cautious with that too.
You do.
Because a lot of those fruits will get stuck in between your teeth, and if you don't protect your teeth right after you eat or
Right,
consume these
raspberry
things.
seeds, things
Right,
like that.
yeah. So talk a little bit about health foods, and sometimes you have to be a little bit more cautious with some of
Right.
that.
Well, and the other thing is too much of a good thing is not a good thing.
Right, true story, yeah.
And when you're juicing, you may take in more calories, you may take in more sugar because it's so easy, and you don't feel full.
And you think you're just eating a bunch of fruit.
Right.
No,
Oh, this is so healthy for me.
Well,
no,
you
yeah.
can accidentally have like 30 oranges because you're juicing, and it's like that's not a healthy amount of sugar,
Right.
even if it's a
Or
plant.
vitamin C. Yeah.
I made this mistake a long time ago, but yes.
Yeah, so you want to kind of moderation.
Yeah.
You know, you don't want to eat right before you go to bed. Same thing. You don't want to put Pepsi in your baby's bottle.
Right.
Or milk even, really,
Yeah.
because that's got a lot of sugar content
No
in
sweet
it.
tea,
So
huh?
Right.
Only in the
seriously.
South.
But I was raised on that.
Only
So
in the
don't say
South.
that.
So a daily regimen, good regimen. You wake up, obviously you take care of, you do the whole gamut, right? You're going to floss, you're going to brush your teeth, you're going to rinse. Are you saying to do that every single time you have a meal or a snack? What's a good like daily routine?
So you reality or good, you know, if you're going to clean your teeth, brushing and flossing is great.
So you're not going to wear away the enamel. I'm saying if you overbrush all day long.
If you're unless you're using a wire brush or,
Gotcha.
a high
Okay.
abrasive, you know, like straight baking soda and salt. That's a bit,
remember
that's
those
harsh.
days of baking soda? Yeah.
All the time.
Seriously, I was a
and
bad
it tastes
kid.
great.
I wouldn't go there.
Me neither.
I'm not getting any wine recommendations from you.
Flossing once. I have good wine recommendations.
I know, I'm
Flossing
teasing.
it once a day is I think adequate.
Yeah.
Sorry to say as a dentist, but yeah, you know, if you can floss once a day, that's the nice thing about the water pick. You can do it in the shower,
True.
and you can do it at night too. What people always say is like, I'm amazed at how much, you know, I floss and then I water pick and stuff was still coming out. So
Of course.
and, you know, and if
Yeah.
you have bigger spaces between your teeth, then you're going to catch more food, and that's you know, that's just kind of normal. And if your children don't have spaces between your teeth, they need braces
Yes.
So when are kids supposed to start flossing?
when their teeth are touching.
Okay, didn't know that. Okay.
Yeah, so that's the beautiful thing about the children's teeth.
Yeah.
They're not. while
I'm
they're just-
babysitting my niece tomorrow night. We're flossing.
There you go.
So I'm excited. Okay. She's not going to like me. That's
She's
gonna be
like, what is wrong with you?
That's the last time she's coming around the baby's
That's
house.
exactly why we're flossing.
Explain me how this works, Davey.
I love you,
You
Tay.
gotta give out cookies.
I was like,
and
where's the ice cream?
Yes, Davey, you're doing this wrong. Let me help you.
I
Let
went
me
to my
help you
uncle's house.
help
He
you.
cleaned my teeth. Could you imagine? She's 7. I couldn't
So
imagine.
Bobby points out that Fritos and Cheetos both crunch. So are those good?
But they have with toes, right?
They have toes. Yeah. No food with toes.
That's
I've got a
right.
couple of questions.
Sure.
I've heard some about remineralizing
mineralization.
teeth.
Yes.
Is that possible? If you have damage from not taking care of your teeth, can you come back from that?
So it depends on how much damage you have, and there's a lot of recent studies with younger people in remineralizations. They have some silver product that you can put on there.
Mhm.
It turns it black, but it remineralizes. And so,
No silver nitrate. Got it.
yeah, right.
You're not good.
And,
yeah.
and there are some fluoride products, and I know that right now there's a big thing about that too. That if you topically apply repeatedly, can remineralize teeth. And you know, people that have their enamel just is weaker or broken down, that's a good place to apply it. But if you've got a cavity, to come back from that is a filling.
Like how long? What do you think the process? I mean, obviously it's going to flux with people, but is there
Right.
like an average? You think?
So I mean, it's months.
fascinating.
Yeah, you know, well, the silver stuff is pretty quick, but you know, they're doing it at like a recall thing, so they're checking people at 3 and 6 months.
Gotcha. Okay.
And there was a product called MI paste that was really good for that too, that you can put on there and help remineralize. And you know, I always give people a chance. So some of the Listerine rinses have fluoride in them. I'm like, you know what? You got the beginnings of it. Let's brush and floss and rinse.
If I could be sponsored by
And,
Listerine, I
you
would.
know.
I really love that product. I know that's probably, I don't know if it's the best, but I love Listerine. It's so good. It just chakras. I mean, like, I'm like, remember like the Big Fat Greek Wedding and he sprayed
The
Windex
Windex,
on
yeah.
everything? Right. Well, Listerine is my Windex. Like, literally, it cures everything
I
for
love
me.
how you're looking at Mike for Big Fat Greek Wedding and not at either.
I know.
one
I
of
wanted to
us.
see, like, maybe I got an eyebrow. Like, maybe, like, Darcy made him watch this at, like, some camp
No.
retreat or something. No, nothing.
No. That had wedding in it? No.
It's so good.
No need to see that. Went to one. I'm good.
It's
I'm good.
really good.
Mine
So,
was awesome.
We mentioned Listerine. There's Act. There's other mouthwashes. Like how legit are these, or are these just like pouring your money down?
Carry
the
free. I don't know if that's a good one. Yeah.
So ACT is, I think more of a habit developer. Listerine has some things in it with some that definitely antibacterial. That yeah.
I always have one. I always have my Listerine.
The heartbreak of halitosis.
Making sure it goes all over my mouth too. See, it's
I
really
see
good.
that.
You want them? Just point and shoot, bro. So good. No, literally, people give me this for Christmas. Like, it's my stocking
That's
stuffer.
the new stocking stuffer.
So
I
good.
see that. Yes.
But it is good to do a rinse. Are you a rinsing family? Like, what's your routines look like?
Yeah, we try and get the kids to floss and rinse. But it's like,
How do you teach little ones to like brush teeth?
They've got colorful flossers that are like shaped like animals, and it helps.
You go circles.
And we were doing okay with that, and then the braces happened. And it's a lot harder to floss with braces, and so it's looking like a water pick might be in our future.
Water pick.
I hear if you buy a minivan, they're giving those away right now.
Oh my gosh.
Yeah, I think you could get a
Don't
minivan
do
and
it.
the water
You
pick.
don't need one.
Yes.
I might have a used water pick. Do you want to buy it? I'm just kidding. Is that awful? Is that bad? You don't do that. Is that nasty? I don't know. It's all the marketplace.
I almost threw up, Davey. I almost threw up.
I think that's worse than used underwear.
No,
'cause at least you can
I
breathe.
know. They sell that at Betty Griffin sometimes. Yeah.
We left the rails. They were a little bit back there. They were
Okay,
back
I'll
there.
bring us back. Floss before or after brushing? Because I saw an expert on Oprah when I was a kid that said you should floss before you brush.
I always floss
and
before.
every dentist and dental hygienist that I've talked to said after. So what?
Yeah,
what say
I'm
you
with the
guys?
after.
Yeah.
Well, it makes sense because then you're actually pushing like some
Yeah.
of the fluoride in between the teeth, right?
That lady on Oprah lied to me. What are you gonna do?
We gotta
Not the
flip
first or
script.
the last time.
You get a car. You get a car.
Back to the minivans. Call me.
Dr. Stephanie, how do you stay ahead of the game? Like, how do you keep track on the dental game? Like, do you go to conferences? Like, how do you change your practices?
I'm
up?
a CE junkie. So
fabulous.
Yeah, no, I want to learn. And,
Talk to us.
I love to learn. And so in the organizations that I'm involved with have international conferences. So I'm learning from foreign dentists.
Okay, cool.
Please
Yeah.
don't tell me you're going to Istanbul sometime this year. Please don't tell me that.
No, she would
No,
never.
Not for dentistry. But
What was one of the last ones you took, and how did it inspire you today? Like, has it?
So the last one I did was the ICMO meeting, which is the International Cranial Mandibular Orthopedic.
Yes.
Yeah, it's a mouthful.
Oh, that
Smile
one.
for short.
Hence the word ICMO. Yeah. And that was in Denver, and we did a lot of the airway. So we were talking about the breathing and the intervention for small children, and just what's available for adults. Adult orthodontics without braces that is sleep focused and airway centric. So just trying to get all that, and when you're around people who like to learn as well, that just kind of rejuvenates you, and you come back and you're even more excited to come back to practice. Yeah,
I love that.
Exactly.
Yeah.
So
I know like breathing is really important, at least in my world too. I study
Essential.
occasion.
What's that?
Essential. Essential.
It's an essential
like
thing.
Wim Hof, exactly. Like I love to like study him because he's all about breathing and like holding your breath and being able to like use your different pathways, because breath is actually like the motivation of your body. It really kind of just keeps everything going and flowing.
Right.
So I think that there's a lot of correlation there. I think that's
for sure.
fascinating. What about the tongue? Does tongue have anything to do
strongest
with your
muscle
mouth?
in the body.
Sharp.
Yeah. So we actually talk a lot about myofunctional therapy, which is essentially PT for the tongue, because a lot of these people with airway issues have swallowing issues. They don't swallow correctly. And especially with children, if they've had allergies and they've been mouth breathers, then they have a tongue forward posture, which is not correct. And so the sooner that you can correct that and learn to do it correctly, then that promotes good growth.
Like
and,
lift talkers, like people that have like.
well, that's usually a tongue tied situation,
isn't it?
Yeah,
Okay.
and that has become finally it's a little more recognized. I get the question, well, I was just at my pediatrician. Why didn't they say anything? Like,
Right. True. Yeah.
well, they're they're kind of they're
Holistic, like the whole body.
this part, not so much.
Right.
Yeah.
The rest of it,
Right.
Yeah.
they go straight back to the tonsils.
Right. Is that why we need dental and eye insurance? Because
Yeah.
honestly, there's more focus on that than the actual whole body. But
Right.
they're all super connected, right?
They're all super connected
Yeah.
for sure. Yeah, and sometimes they just have to see so many people. It's hard to take the time.
True.
So
True.
But you said tongue forward. What does tongue forward mean?
Yeah. So when you swallow, here we get to do a little exercise. Everybody can feel the little dot behind their top front teeth. Feel that dot? Okay. So if the top of the front of your tongue is sitting on that dot, when you swallow, your tongue should go backwards.
It does.
Yay.
Oh, I'm good. Yeah, you didn't do it.
Just stay right there.
Go
was a
see
tongue
Dr. Stephanie.
thruster.
Right.
I was a tongue thruster, and they put the bar in my mouth
Right.
when I was like an elementary kid.
They put a bar?
Yes, they put
Yeah.
a bar in my mouth, and so my tongue couldn't push forward and push my teeth out. That's what they
Wow.
said.
They
Right.
said,
Yeah, they
lock
put a
it up.
cage on my tongue.
Yeah, there's a cage in there.
I'm glad you're free,
Yeah.
little one. I'm glad you're free.
Free Amanda.
That's right.
Mike is so uncomfortable.
No, there's just so much that I could say to Davey, but Dr. Stephanie is here, and so I'm just.
So nice.
There's like,
Pretend I'm not
you've
here.
got like
It's
6
all right.
free passes
I know,
in today's
right?
show.
I
I just
know.
want you to know that.
Did it on purpose.
6 free. He's like,
I feel like he's doing this just to see how uncomfortable he can make you.
Like literally everybody, his computer screen is black. He's actually moved a little bit further away from the table.
we'll be finishing this show.
Pete, that wasn't me. That was him. That was him.
Right. True story.
It didn't crack too much of the glass. Pete, it'll be fine. It'll buff out. It'll all buff out. Yes.
Just like your enamel. Just kidding.
That's it.
Way to bring it all together.
Yeah.
Way to bring it together. Are you singing in the choir anytime soon?
Good question.
Sunday.
Oh, fun. Talk a little bit about that real quick.
What to say?
Oh, okay. So what are you going to be singing? An aria? Like, what are we doing here?
Oh no, I'm singing with other people.
Okay. Diana Ross is coming to
and-
town, and I'm like, this could be your moment.
I don't know if she's stopping by. and honestly, I can't give you the names of the songs, but I have the YouTube video.
Are you an alto? What are you?
I'm a second soprano.
Oh, that's fantastic. Have you been
Yeah.
singing like your whole life, or is this something you just picked up?
No, I've been singing since I guess, in high school. I did high school musicals, that kind
Fantastic.
of thing, and choir. Yeah.
You have
Cool.
to have a good ear for second soprano. That's a hard part to find. I mean,
yeah.
first soprano is right on top.
Well,
Like, you're
usually it's right
there.
on top. It's just, it's a little, no, when it's not on top, you want to be there because you can't get up to that note.
Right,
So you're like, let
exactly.
me find that.
Yeah, you're the one that helps Mariah get up there. Nice.
Yeah. No.
I have no
So-
idea what y'all just talked about.
Yeah.
I understood the dentistry stuff. I got that.
We're talking about bottom support for your voice. There you go.
Got it. Still don't know what you're talking about.
Have me at bottom.
He
Yeah.
just like bottom support. He's all red now.
Yeah.
Oh, Davey.
Brackets.
Davey.
So the brackets have doors now.
I love you, Amanda. That was awesome.
Right. Doors. You can talk about doors.
I
Right?
can talk about doors all day long. There's lots of doors. We got all kinds of doors.
Oh, so
Avro
good.
doors, mahogany doors. There's all kinds of doors. We're good.
Nice and safe.
Yes. Impact doors, Davey. Non-impact doors, Davey. Wow. All kinds of things.
So
In
good.
swing, out swing, Davey.
Some of the
But
options
what
are
about
endless.
back doors? Any impact back doors?
There's impact back.
And the doggy door is another one's very important to have in life.
I think you've taken us way off the rails today, young man. Welcome back.
Happy to be back. And
Pete Melfi doesn't let you talk about this on the morning
no,
show.
I never get a chance to have a personality on any of the shows except on this one.
You're so good.
Dr. Stephanie, thank you so much for your time tonight. That was
Thanks for having
awesome.
me.
Always a pleasure to have you in studio and clearing up a lot of dental like rumors and and fear. And I think
Right.
that's important that you're instilling like the faith and confidence in people, which I love to see that. That's
Yeah,
awesome.
for sure. Thanks for having
being
me.
here. Yeah.
Thank you.
Yes.
All right, we'll be right back. We'll be back tomorrow. There's a morning
Yes.
show on first
That's right
thing.
back.
There's Davey will be here in like 7 hours. She'll be right back. You guys will be here 7 hours, and then there's an afternoon show, which is the most popular show on the network. I hear. Is that true?
So good.
Has Arbitron rated you the most popular show, or did Davey rate you the most popular show?
I'd probably
The
me,
viewers.
but I mean, I'm just as
viewers.
good as an IOU. So
Hold on to that one.
And then we'll be back tomorrow night. Thank you all.
bye, guys.